So hello everyone, my name is Crystal and today I will be presenting my Public Health 122 content creation oral video policy presentation. And my chosen topic for today is Medicaid. Okay, starting off strong, I would like to introduce the Medicaid Care Connect campaign. Through this campaign, we'd like to provide individuals with resources and guidance on Medicaid. We also want to be able to help those who are unaware of their benefits learn about their benefits and also learn how to access it as it varies by state. We also want to be able to bridge a connection between you and your healthcare. So with that, I would like to say your care starts with a connection. Okay, so today we will be going over Medicaid, your eligibility requirements, your coverage and benefits, and the application process. So, what is Medicaid? So, Medicaid is a joint federal and state program that provides health coverage to millions of Americans, of which include low-income adults, children, pregnant women, elderly adults, and individuals with disabilities. So, we ask the real question, am I eligible? And the main eligibility groups are going to be low-income families, pregnant women and children, and individuals receiving supplemental security income. However, I would also like to note that there are more eligibility groups outside of these three right here. This is why I provided this link right here to the actual Medicaid website. And if you press on this link right here, it will navigate you to eligibility policy. And on this link, you can just press mandatory eligibility groups, and it will give you a whole list of eligibility groups to see if that you can use to see if you are qualified. Okay, so there are two factors that are considered for eligibility, one being financial and the other being non-financial. Starting with financial, modified adjusted gross income is considered, and taxable income and tax filing relationships to determine financial eligibility for Medicaid is also considered. Individuals with blindness, disability, or are over the age of 65 are exempt from this factor. However, their non-financial eligibility is a little different for this factor right here. Um, r- Individuals who are applying for Medicaid must be residents of the state that they are applying in. So if you are applying in California, for example, you must be a California resident. And secondly, you must also be a US citizen or certain qualified non-citizens, which are lawful permanent residents or green card holders. Okay, and I would also like to mention other guaranteed eligibility groups briefly, which include individuals who are enrolled in SSI and the Breast and Cervical Cancer Treatment and Prevention Program, children with an adoption assistance agreement, and young adults who are former foster care recipients. Okay, so what is medically needy? So medically needy is a program that allows individuals with an income that is too high still be able to receive assistance in covering their medical expenses. So when an individual's incurred expenses exceed the difference between income and state's medically needy income level, they can qualify for Medicaid. So right here, I've provided an example. So say your income is 1,200 and the state that you're living in, the medically needy income level is 300. So you would basically find the difference between these two, and that would be your spend down amount. So right here for this example is $900. So the spend down amount is important because it pays for your medical expenses. But once your medical expenses exceed 900 or the difference, you may be eligible for Medicaid for a short period of time. Okay, so say you do apply for Medicaid, but you are denied. You are given the opportunity to file an appeal, actually. So for more information on filing an appeal and on how to file an appeal, you can visit this website that I provided right here. And this includes all the information that you'll need to file for an appeal in your state. Okay, and there are two strategies that are used when considering eligibility. Firstly, we will be talking about the presumption eligibility strategy. Through this strategy, basically your state agency facilitates enrollment of individuals who are likely eligible. And the benefit of this is that you will not have to wait for your application to be reviewed. So basically qualified entities, which include schools, communities, or hospitals, was a school for eligibility and newly enrolled eligible individuals. And also help families gather documents to complete the full application process. But the downside to this strategy here is that it's not provided in all states. It's only provided in California, Colorado, Connecticut, Illinois, Indiana, Kansas, Michigan, Missouri, Montana, New Hampshire, New Jersey, New Mexico, New York, Ohio, Utah, West Virginia, and Wisconsin. And the second strategy that we have right here is the express lane eligibility strategy. Through this strategy, enrollment is simplified and renewal is also simplified for Medicaid because they are going to be relying on findings from other programs like SNAP, TAMP, or the school lunch program, or women, infants, and children. There's other groups that are, or other programs that are also used to, that can be used for your enrollment and renewal. This strategy right here is only provided in Alabama, Colorado, Iowa, Louisiana, Massachusetts, South Carolina, and South Dakota. So one thing to take note of, this is extremely important, but your Medicaid benefits, the benefits do vary by your state, depending on if they are an expansion state or a non-expansion state. Talking about expansion and non-expansion, here I've provided enrollment data for Medicaid in July 2025, which is very recent. And one thing to take note of is that the Affordable Care Act allowed states to expand Medicaid to cover all low-income Americans under 65 in 2010. So this explains the 41 expansion states and the 10 non-expansion states right here. So on the left, everything is color coded. So there you can see that the majority of the states in the US are expansion states, and there are a couple that are non-expansion states. This is extremely important in regards to figuring out what benefits are provided for you, depending on which state that you live in. And there is a large number right here. 70,356,307 people were enrolled in Medicaid since July 2025. And all this information can be found on the Medicaid website. Okay, so speaking of coverage and benefits, I will be going over the costs, transportation, long-term services and support, and home and community-based services. However, starting off, very recently in 2024, the final rule for ensuring access to Medicaid services was published. And basically, this final rule improves access to care, quality, and health outcomes. And it also addresses health equity issues, managed care delivery systems, and in-home and community-based service programs that I will be explaining further later. So starting off with costs, Medicaid does pay for Medicare premiums, deductibles, and co-insurance costs for those who are dual eligible. So dual eligible basically means that you qualify for both Medicaid and Medicare. And Medicaid does also cover your outpatient prescription drugs if you are eligible. However, states do have the option to charge premiums and establish out-of-pocket spending requirements for Medicaid enrollees depending on your income. So basically, for example, right here, pregnant women and infants with family income at or above 150% FBL, qualified disabled and working individuals with income above 150% FBL, disabled working individuals under the Ticket to Work and Work Incentives Improvement Act of 1999, disabled children eligible under the Family Opportunity Act, and medically needy individuals are susceptible to being charged premiums and out-of-pocket spending / expenses. Okay, so Medicaid does provide individuals who are eligible transportation if they don't have transportation. So there's two types of transportation, one being non-medical and the other being non-emergency medical. For the first one, for non-medical, transportation is basically through private or public vehicle for people who do not have another way to get to their appointment. And medical enrollees and Medi-Cal enrollees, this is specifically for California, and pregnant women are eligible. Basically, you would just contact your plan and they will contact your transportation provider, and through them, they'll be able to schedule transportation for you. Secondly, for the non-emergency medical transportation, this is basically through ambulance, wheelchair van, or litter van for those who cannot use public or private transportation. The process is a little different for this one right here. You will basically be contacting your plan to request this transportation, and you will be needing a prescription from a licensed provider. Okay, so here we have a long list of long-term services and support that Medicaid has to offer. Basically, older people, people with disabilities, and or chronic illnesses are given the opportunity to decide where and with whom they live, to have control over the services they receive and who provides the services, to work and earn money, and to include friends and supports to help them participate in community life. Secondly, Medicaid does provide support for people to live where they want to live with access to quality services and supports in the community. We also provide high quality services that improve your quality of life. Medicaid also wants to achieve economy and efficiency by managing services paid that are appropriate for the beneficiary and paid for the appropriate party. Fifthly, they also want to make effective use of health information technology to provide transparent information to consumers, providers, and payers. And lastly, Medicaid also provides accessible information and services to take into account cultural and linguistic needs. Okay, and lastly, we have the home and community-based services. So home and community-based services are basically services given to those who are over the age of 65, have disabilities or disorders. Um, Basically, they will be receiving services in their own home and communities. On the left right here, I do have some data from the Medicaid website itself. Around approximately 86.2% of long-term services and support users have received home and community-based services in 2021. And also we have 63.2% of long-term services and support expenditures were for home and community-based services in 2021. Okay, and the most important question, how and where do I apply? So it's fairly easy and simple. You would basically just visit this link right here. You can also just find it by just typing in medicaid.gov. But right here, if you press on this link, it will navigate you to this page right here. And on this page, you will provide your state. And then from there, the website will navigate you to your state's website so that you can go through with the Medicaid application for your state. It's a little different for all the states in the United States. And just a couple notes to think about. Your coverage does begin either the date of your application or the first day of the month of application. And benefits can be covered retroactively up to 3 months prior to month of application if the individual would have been eligible during that period he or she applied. And finally, coverage does end at the end of the month if you are no longer eligible. And for more information, you can just go ahead and visit medicaid.gov right here. Okay, and that is everything. Hopefully this campaign has helped you learn more about Medicaid and your benefits and coverage. And hopefully this has allowed you to decide on if you want to apply to Medicaid. We want to be able to provide you with that connection between you and your healthcare. Leaving off on that note, I would like to say a friendly reminder, your care starts with a connection. Thank you.